You realize how important it is to have aerobic metabolism versus anaerobic metabolism. And so when we were told this morning that to some degree the neogenesis of arterial blood supply is being inhibited by GcMaf, I start to worry a little bit, because it allows the cell oxygenation will be probably not very well supported. Okay, and meanwhile, you should have a copy of these things, I hope, and please, an appeal to all of you, contribute to it. If you find something more, so I'm not feeling entirely lonely in El Paso, in West Texas. Okay, next one. Maybe you, yeah, okay, you can go ahead with that one. So of course, keep going, and it's there's a threonine amino acid in the position 420, which is somewhere located in this area. Now, I have not figured yet how we can flip this molecule around, because it would go along with the general pictures we have in our mind. At least in my mind, I have a picture that there should be on the other side. But we have not figured that out, how to flip it. Because this is where the GcMaf molecule is being attached here. It's very interesting. This it has 3 domains and has also 3 functions. And it binds actin here, depicted in green, and it also is useful for the transport of vitamin D. And I'm very curious here, because we have found, if you look at your chart, we have found if we use vitamin D2, it has an immune stimulating effect. If we use vitamin D3, it inhibits immunity. So we have been very careful to utilize that, but I've read through some of the papers also concerning GcMaf by Nabuto Yamamoto, and they're stating that it's a vitamin D3. So that is somewhat of a conflict, at least from my observation. And for the time being, I much rather go with vitamin D2, which I happen to know being on the left side of things. So, and it's only less than 5% of this protein is complex with vitamin D, and so on. Okay, let's go on. Ah, yeah. Now there's a beautiful little video on YouTube about GcMaf, and I only can recommend it that it shows a gentleman there with a pair of scissors cutting off certain things. Now, this is position 420 on that vitamin D carrying protein, and this has a trisaccharide. There are 3 oligosaccharides attached to it. There's a G, which is galactose, and sialidase here. And then the active aspect of it is the N-acetylgalactosamine, which binds those other 2 sugars. And I don't know where the thing is, but on the other hand, you can see that this, once it's being removed, this complex here can stimulate the macrophage to activate it. So it fits in here like a key, and then the macrophage is being activated, but in order to do that, you have to get the key, so these 2 molecules have to be removed to activate this thing. Now, tumor cells apparently have learned to produce a substance which is the N-acetylgalactosamine ASE, to remove that. And so they secrete that and nothing happens. So the macrophage, they stay asleep and will not be activated. It's rather ingenious survival for the cancer cells. Okay? Well. go one higher, maybe. Yeah, I don't know. Okay. Well, is that it? No more pictures? All right. Well, that's as well, because this is the gist of the whole thing. And I try to keep it simple, so we have a model in our minds with which we can work with. And I hope I don't know if there's time enough to entertain any questions or comments. It's up to you.
Anyone got a quick question or two?
I was surprised to hear that melatonin was immunosuppressive.
Yeah, yeah. Well, it's like thalidomide. It has a, no. They're a very interesting thing, because when you look at that list, there's certain things, so-called natural substances there. Melatonin is used as a sleeping aid, very nice and natural. It stimulates the pineal gland and all this stuff. Yeah, like everything else, you know, there's a price for it.
But it's used as a cancer treatment very widely.
Yeah, I try to avoid it, yes. Even chlorella, I try to avoid it, things of that sort. And sometimes I still fall into the trap frequently when I try to detoxify somebody from heavy metals. I like to use chlorella, but then I have to be very careful that if they have an autoimmune disorder, that I shall not use it. Yes, ma'am?
Just a quick comment on chlorella. Well, I have a question. Chlorella also has binding properties. So when I use chlorella after meals, you're actually binding the stuff that is excreted through the bile, and it's actually beneficial because people do not reabsorb toxins. So there are kind of benefits and pros and cons here.
Yep.
But the question that I have, you presented IgMs and you presented interleukins. What about the prostaglandins? That's the part that was kind of present in the...
Again, you know, prostaglandin, I follow the KISS principle. I want to keep it simple. Now, since David Noakes already alluded to that some people in my community and in Mexico and so on have been treated with that, I must say we have had some spectacular successes, but also spectacular failures. So, Mr. Gregorio Cuesta, who has communicated with you many times, yes. He was a reject from MD Anderson, which is our big cancer center in Texas and Houston. He was rejected there because they told him your prostate cancer is so much advanced, it even inside the skull, everywhere. They never had seen a bone scan like his, and he was beyond treatment. No chemotherapy, no radiation, no surgery. So they told him, go home, get your affairs in order. The average survival at that stage of prostate cancer is 4 months, maybe 6 months. And I don't know where you heard it, but he was somewhere told on the way home to Mexico, stop by in El Paso and get a second opinion. And so we started him on GcMaf. His PSA, prostate-specific antigen, was way over 1,000. All this, you know, his prostate cancer was in full swing. And so GcMaf was started with your help, and he had a spectacular response to it. And 1 year after starting all this stuff, I saw him in November in 2011, and his PSA was a little bit around 11 or something like that. From 1,000 something, came down to 11. And he told me, well, the only thing I would like for Christmas is to get a PSA less than 10. But anyhow, so we pursued him, and he had his normal life back. However, something was very, very strange with all this stuff. I noticed that he had a drooping of one eye, a little bit. And so I started getting ready to start investigating that, but he had to go back to Mexico, and then he was somewhere at a resort down there at the seacoast, Pacific seacoast in Mazatlan, and then suddenly had a major seizure. He wound up in a hospital. They did a CT scan, big brain tumor, and they could not operate on him. He was not able to be transported because he was in coma then, and so they couldn't do anything about it, so he died. So it's an awful situation, but now in view of that some of these GcMaf is being utilized to treat brain conditions, I started to ask myself, how much of this actually can cross the blood-brain barrier? And I'm kind of waiting for an answer, because why should a brain tumor occur while all this is being treated? Yes, sir.
Dr. Yamamoto treated many brain tumors to the eye, and it crosses, it works on the brain. Actually, I discovered many brain tumors by giving GcMaf. Many brain metastases. They were not aware of it, but the GcMaf created swelling around the tumors, and they got the symptoms after a few injections of GcMaf.
They got less.
More.
More tumors.
No, not more tumors, but more symptoms.
More symptoms.
The GcMaf creates a swelling around the tumors.
Yeah.
So after giving GcMaf, the tumors were detected.
Yeah.
Cornelius, isn't it the case that Gregorio left you and went to another doctor? After you
He went back and forth to MD Anderson.
Right, and he stopped taking GcMaf, didn't he?
Ah, that I did not know.
Sorry?
That I did not know. That happened in Mexico. That's just a little bit of
what actually happened was he went back to his last doctor and he stopped taking the GcMaf. And it is fatal to stop taking GcMaf until your nagalase has got below 0.65. And so he got this completely new, unrelated cancer because he stopped the GcMaf too early.
Okay. Thank you for telling me, because I kind of wondered what I did wrong with all this stuff. Then there's another 41-year-old lady with a 4-year-old daughter who developed breast cancer and had metastatic disease and underwent chemotherapy, radiation. Actually, she had metastatic to the spinal cord in her neck. And they did everything maximum, and that was it. Bates, Westphal.
Oh, yes.
Yes.
Yeah. Okay.